Debbie actually sought out exercise to help with the pain, and I think that's an excellent idea. For some people, exercise initially may aggravate back pain when it's first occurred, and in that case, some activity and exercise is important, but certainly not to the point where it aggravates their back pain. One of the things that we've learned in recent years is that going to bed rest and completely avoiding all activity can actually delay the recovery from a back sprain or an episode of back pain. Nowadays, at most, a day of complete rest and then trying to be as active as possible but avoiding the specific positions and activities that worsen the pain is really the fastest way to get over a back pain episode. Often people worry about, am I making it worse or am I going to hurt something? And more often than not, other than the pain, the activity is usually helpful for stimulating muscles to heal and for keeping strength in the core muscles and for not having secondary problems develop like weakening of the muscles from inactivity. Most back pain, even when it's chronic or ongoing, is successfully managed with various non-surgical treatments. Nowadays we have modern techniques for surgically treating back pain, including spine fusions, disc replacements. But it's important to understand that the majority of people with backache are not going to really be candidates for one of these surgical treatments. There's no one formula or type of exercise that's going to work for everyone, and it's important to, if somebody is having recurrent back episodes, to seek out somebody who has experience with designing an exercise program that would be customized for their particular situation. Walking is an excellent way to stay active, especially when you have back pain. Usually walking will not aggravate the pain as much as prolonged sitting or bending or stooping or twisting or heavy lifting. And those are really the activities to try and avoid when there's a new episode of low back pain. For some people, doing abdominal exercises is very helpful for strengthening their core muscles and helping their back pain. For other people, that aggravates their back pain, and extension exercises where they arch their back and strengthen the muscles on the back side of their spine is actually helpful. There's no one formula for all back pain, and that's the reason that there are actually very few scientific studies that prove that anything can actually help back pain beyond the natural history or what Mother Nature herself can do.